So we're going to talk about short-term memory loss and brain fog part 2. For those of you who watched last week, that was part 1, even though we didn't announce it. And we're going to be talking about bringing clarity to your thoughts. I am Dr. Martin Rutherford. I am a chiropractor. Since 1979, I'm also a certified functional medicine doctor. And this is
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
For those of you who haven't seen us, years ago, we put together these two disciplines, functional medicine and chiropractic functional neurology. And we put them together in an attempt to start to figure out chronic pain. And it seems like we feel like we've got a pretty good grip on it at this point in time. So a couple of years ago, we just decided to start sharing what we're seeing here in our practice, in our results, relative to, if you go back and look at all of our hangouts, all of them have 5, 10, 15, 20, 30 peer-reviewed references after them, so that you can see that we're talking not just from our experience, but from what's in the science, and we're sharing with you what we're seeing and how it's working, and in people ultimately developing a chronic pain practice, people coming with fibromyalgia, chronic fatigue, peripheral neuropathy, restless leg, all these different things. A substantial portion of them come in with short-term memory loss and brain fog. Very few come in for that. We're starting to get some for some reason. For some reason, we're starting to get people coming in for short-term memory loss. But for the most part, people are coming in with it as a part of another clinical presentation. And for the most part, once we're done with their fibromyalgia or their peripheral, their chronic fatigue, their memory loss and their brain fog is much better. In handling these problems, these conditions, we had to realize that it couldn't be symptom-based, but it couldn't, in many ways, it couldn't even be organ-based. It had to be systems-based. And you hear us talking about the digestive system, and you hear us talking about the immune system, and you hear us talking about the nervous system all the time, because those are 3 big players in pretty much everything we do, and we're probably going to talk about them again today because there are players in short-term memory loss. And I think the reason that I'm hearing it more is I think a lot of these folks are coming in now. Alzheimer's has become kind of front and center, and I think it's because more and more people are looking around, more and more people know Alzheimer's patients, and more people are thinking, oh man, is this where it's going? So that's kind of the layout here. Last week we talked about, I forgot, we have short-term memory loss. Last we talked about brain fog. And so there's an overlap here. Maybe do a little bit of a recap of last week for those people who weren't sitting on the edges of their seats listening to us talking about brain fog last week.
Yeah, so last week when we talked about brain fog, we were discussing technically the definition of brain fog is where you'll have problems with short-term memory, long-term memory, or just an inability to really concentrate or focus, or they term it dyscognition. So your ability to think is perhaps a little bit slow, and you have to exert more energy in order to think. And when you exert more energy, they feel that that's fatiguing, and that's why a lot of people sense that element of fatigue associated with their quote-unquote brain fog. And then in today's broadcast, we're really going to go into more details as to how we kind of form memories. Most of you realize that your memory may be poor. You walk into a room and you may not know why you're there, or you can't remember what you're supposed to do this afternoon. Once you're in the grocery store, you can't remember the list of foods that you wanted to get. And so you're having to take lists all the time, and you notice that that's somewhat bothersome. Those are the elements of what we're talking about, but in today's broadcast, we're going to go definitely quite a bit deeper, and we're going to let you know kind of how memories are formed, what parts of the brain are involved with a little more specificity, so that you can really understand what's going on, and then also what factors in your physiology are causing your memory to be abnormal.
Yeah, and how complex it is, how they intersect, and how you might go about working with those factors, and why maybe some of your self-directed efforts have worked, and maybe why many of your self-directed efforts have failed, even though maybe you've read about this solution in an alternative healthcare magazine, or maybe you've even gone to an alternative healthcare practitioner and had bits and pieces of what we've talked about done and not had success. We'll talk about why that is. We're going to tell the story of HM.
Yes.
I don't know what HM is.
HM.
Is that one of our patients?
No.
We tell the story of HM and our understanding of memory.
So HM is not one of our patients. HM is a classic case from the literature where HM basically, in essence, suffered a brain injury, and then he developed chronic refractory temporal lobe epilepsy. So he had seizures due to his brain injury. And no matter what medications they gave to him, nothing was helping. And this was way back in the era where they were doing brain surgeries, and they were just, now brain surgery has evolved a lot, that's what I'm saying. But what they did is they went in, they cut out most of his temporal lobe, specifically the area involved with memory. And so this provided just a classic case for scientists and neuroscientists, as neuroscience was really starting to bloom, to study what effects a person would have by cutting out this memory area. So what would we lose? What would we still have? With me?
I am.
Okay, perfect. I always check because
This was, as usual, there's always an evolving surprises to me during these.
I even
so
gave this to him 15 minutes ahead of time.
You did. You did.
A little pat on the back today.
I did.
So it wasn't like the last second. So nonetheless, with HM, he was observed to have still a number of things that were still working. So he was able to remember like a phone number for 2 to 3 minutes. So he could just keep reciting it. He could keep reciting it, and he was able to remember it. And then he was also able to do other tasks, like he could look in a mirror and trace a star around his hand, and he was able to do that and get better and better and better. So he was able to learn. He was able to accomplish some tasks involving like motor movements in a stepwise normal fashion like you or I would be able to do. However, if you would distract him and then you would ask him what the phone number was, he couldn't remember it. Now, probably a lot of you watching today's broadcast have had similar experiences where somebody tells you something, you get distracted, and then you can't remember it. And in fact, when we do memory tests on patients, that's one element of the test, is we'll give people, okay, remember these 3 words, or remember this phone number. And then we ask them a bunch of other questions, and we say, okay, what was the phone number that I gave to you? And if you have problems with short-term working memory, moving into long-term memory, you're probably going to have some difficulty with that task. HM is another example. He couldn't remember his psychologist, so he would meet with her once a month, and every month it was like a new deal to him where he had not met her. And so it just really was a great example in the neuroscience literature of what happens when we cut out the medial temporal lobe. This is specifically referred to as the hippocampus and the hippocampal formation. We try not to give you too many words like that, but this is something you should know if you suffer with short-term memory or probably just short-term memory if you're watching this broadcast.
So they cut out his hippocampus.
They cut out his hippocampus. They cut out a few other things like his amygdala and some parts of his dentate gyrus.
Okay. 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 So that's important, but it's not. Okay. I get it.
So they cut out his memory area, or what we perceive as the memory area. But the interesting thing with HM was that he still had a lot of long-term memory. So he still knew like his social security number. He knew his birth date. He knew where he grew up. He didn't really have a good memory like a couple years before the surgery. So all those long-term memories from 2 years before the surgery, they were pretty much gone. But other childhood events, they were still there. And so that shows that long-term memory is in other areas of the brain. So we have people who listen to these via podcasts, so we don't always bring visuals on, but just know that some of these memories, these long-term memories, will be stored in other association areas in the brain. So maybe in the frontal lobes, maybe in the parietal lobes, maybe other areas of the temporal lobes, but they don't just have to be in that hippocampus. The hippocampus is kind of like the relay station from taking, okay, what's the phone number? In 2 minutes, 3 minutes, do we still have the phone number? Can we store it? And then through time, can we make it into a long-term memory so that we never forget, you know, what your address was when you were 10 years old?
Okay. And that was going to be, that would have been my question if I were listening. It was, okay, this is short-term memory. Where is the long-term memory? And you just answered that. I think the takeaway from that is it's going to be important to understand the rest of this, to understand that concept. The hippocampus is your memory area, which affects a lot of other things, but that's your memory area. And so, but it's not just, well, I don't think, I don't want to get too technical. Okay. We got part of it, memory goes in, and then it's got to become short-term to long-term. And we'll talk about how that works.
Yes, we will.
Okay.
We will.
Okay. You got to go to sleep, right? So they say that, I'm not the brain guy here. Okay. Obviously. Isn't it that if sleep helps to translate short-term memory into long-term memory?
I believe it does, but I think you can do it without sleep too.
Oh, wow.
For those of us who cram for
sleep.
tests and don't sleep a lot.
Who don't sleep. Okay. So, well, where do you want to go with that?
Well, let's do some examples of
definitions of implicit memory. Okay. Some examples of how I learn, actually. This is, I had again, I've had kind of an interesting experience through life. And I was just telling Dr. Gates beforehand that I used to be able to just read and learn. Then I got a concussion. Then I had to read 6 times, then I would learn. And then it would stay with me for a long time. And I was just saying, I'm noticing now that that when I learn something, even though I'm in here every day, I'm talking about this stuff, we're using it, I'm working with it, we're doing examinations, I will still forget things that I'm working with every day, and then I have to go back and read it again. It's pretty weird, but that's those different parts of the brain that aren't connecting. I've had a lot of concussions and some other things, so that's why that's occurring.
And you are far better than you used to.
Oh no, and I know how to deal with that. When I'm listening to you, I realize that I've come up with other solutions for being able to function during the day, and it takes a little more work, but I'm able to do it. So implicit memory is one. Like Dr. Gates, when we were talking about it before, he said it's like shooting a free throw. For those of you who watched the Villanova game last night, North Carolina game last night, it's like shooting a free throw, or probably like shooting those threes at the end of the game that those guys just shot off. You probably didn't watch it.
I did not watch it.
No, he's not a basketball guy, but 2 amazing shots at the end of the game that they just kind of let go without thinking about it.
Okay.
But why don't you go ahead and talk about implicit memory, and then we'll go back to short-term memory.
So implicit memory, people would understand that as like hitting a golf ball, and when you first start out trying to swing a golf club, you're probably not so good at it, but as you practice, your implicit memory for doing that task will become better. Or hitting a tennis ball, same thing as shooting a free throw in terms of the memory storage. Also, there's these things referred to as cueing, or like Pavlov conditioning is how you would know it. So like when we ring the bell, the dog comes over because it thinks it's going to get its food or its dinner. That's referred to in the neuroscience literature as certain types of conditioning. And so that doesn't really involve, it's a form of learning, because like when the dog hears the bell, then it runs to get its food. It obviously remembers that bell equals food. But, and I shouldn't say obviously, so the dog remembers that the bell equals food. But that doesn't really involve this hippocampus that we're talking about. And the hippocampus is you can kind of think of it as being deep in the center of the brain, kind of in the bottom part of the brain, deep in the center and on the bottom. Hopefully that helps.
I'm sure it helps. I'm sure everybody out there knows brain anatomy. And for the record, you were talking about the implicit memory in the swing a golf club or taking free throws. A lot of people call that muscle memory. There's no such thing as muscle memory.
No.
That's okay. So just for the record, in case you want to know, there's no such thing as same thing as there's no such thing as fibromyalgia being pain in the muscle fibers. That is nerve pain. This is not muscle memory. This is brain memory. This is nerve memory. It's just
other areas of the brain different from the hippocampus.
Exactly.
And the hippocampus is so important to today's discussion because a lot of disorders seem to cause havoc in the hippocampus. So the hippocampus is very metabolically sensitive. It's very toxin sensitive. It's very trauma sensitive. So for those people who have had 1 to 8 different concussions, those concussions, one of the first places they cause problems is in the hippocampus, because we get a lot of inflammation in that spot. The inflammation doesn't allow those brain cells to work too well. The immune system gets inflamed. And as a consequence of that, people who have had concussions, for example, have major problems with short-term memory. It's very, very common.
Yeah. Yeah. I have nothing to say. I can't remember what we're talking about. Of course, somebody had to say that at some point in this, right? So I know when I've had several concussions, and I had one that was really major. And I was going to school back at a time when you could come out with less than $250,000 in debt, but still I wanted to finish school in time so that I didn't come out with any debt. So I had to study all night, take a test, pass it, go to sleep. I would wake up. I couldn't remember anything about what I learned to take that test.
And to put this into context, this happened after Dr. Rutherford had been kicked in the head playing goalie,
playing soccer,
where he lost consciousness for 20 minutes. Was not taken to the hospital.
A little inflammation there.
Left on the sideline.
This was back in the early 70s.
It wasn't until many, many hours later that somebody finally got him to the hospital. Where the treatment at that time was not astounding for traumatic brain injuries.
Wake you up all night.
Yeah, they just watched you
up, make sure that you didn't die.
And so for about 6 months after that, because him and I have talked about this story several times, is that 6 months after that, he had to study in this fashion, where he'd have to stay up all night to remember, then he'd take the test. And then basically he was doing something similar to what HM would do with the phone number. So HM could keep repeating the phone number, and that's a way to develop short-term memory. So for those who cram for a test, you're just repeating the information, you're looking at the information, But if there's difficulty taking that information from short-term to long-term, then you can't go to sleep and then wake up the next morning and take the test because it will be gone.
Right. So we discussed implicit memory. So now you want to discuss explicit or declarative memory.
Those are just fancy terms. We just want you to know.
I'm going to try to not get too academic here.
I'm with you. So we're just mentioning those. But the difference here is that this is what most of you are dealing with. These are the problems of you can't remember someone's name. You can't remember how to get to a certain location. Like they cut down the tree at the corner where I used to turn, so I don't know how to get there. Well, that's a visuospatial problem with your working memory moving into long-term memory. And these are involved in different sides of the brain. And that's one point we really wanted to hit on, because we do look at how the brain is functioning from left side to right side and vice versa. And so for those of you who can't remember names, who can't remember numbers, you know, you study for a test and it's a new vocabulary. Say you're taking a biology class or you're taking a Spanish class and you just can't remember those words. That's your left hemisphere. More specifically, it's really your left frontal lobe, specific parts of your left frontal lobe I won't get into, talking to your left hippocampus. Whereas if you have problems with spatial orientation, to where, you know, you just can't remember how to get to Jenny's house and you've been there 3 times, well, that's your right frontal lobe not being able to communicate correctly with your right hippocampus. So that's visuospatial issues. And so a lot of our patients will report problems with one or the other. If you're reporting problems with both, then that just typically means, in our opinion, that there's some inflammatory problem that's so severe, it's really causing issues in both sides of your brain. But within the context of the hemispheric dominant model, so we know that we may use one side of our brain more than another. We commonly see that in our office that, like, the fibromyalgia patients, the chronic fatigue patients, the anxiety patients, their left hemisphere, just as a generality, not all the time, seems to be functioning at a lower rate than the right hemisphere. We're not saying they have a tumor or stroke. We're just saying that there are signs typically there to indicate that that area is just not doing as good. Well, we see commonly symptoms such as this, like they'll have problems with naming, remembering verbs, remembering nouns, difficulty word finding, associated with that left side of their brain, because we speak from the left side of the brain. The right side of the brain is your abstract thinking. The right side of your brain is your creative side. The right side of your brain is, again, spatial orientation. The left side of your brain is more the analytical, the vocabulary, things of that nature.
Okay. That was pretty academic.
That was still too academic?
I think so. So, no, well, You know, I
Okay.
mean, I mean,
All right, then I'll distill it
I
down.
mean, he could do this in his sleep. You know, this is normal to him. He thinks we all know this stuff.
Well, this is me trying to bring it down to your level.
Trust me, this is him being. So here's the deal. Here's what you want them to know, right? You want them to know that. Correct me if I'm wrong, okay? Because we're going to tell you how to help your memory here, okay? And you might be going like this right now. So we have something called the hippocampus, and that's the guy. That's short-term memory, all right? And
the frontal lobe connecting to the hippocampus, yes.
And the thing to understand is that there are multiple parts to the brain that are also involved in memory.
True.
Particularly changing short-term memory to long-term memory. Okay. That's what you need to know. and then the hippocampus and the frontal lobes and the temporal lobes, but we're particularly going to focus on the hippocampus, can be affected by a lot of different things.
And the frontal lobes too.
And the frontal lobes too. And they can be affected by a lot of different things that are going to cause them to not work right and create short-term memory and a la brain fog from last week, that you think you're going Alzheimer's, but things that can be corrected, usually without drugs, to start to restore your memory.
True.
Okay.
And I do want to hammer home the point though, that if you have problems with like remembering names or finding the right words or remembering numbers, it's probably the left side of your brain, very simplistically, that is involved, versus if you have problems with directions or finding your way around town, it's probably your right hemisphere that is involved. That can't be too complex.
No, it's not. I'm not sure why they would want to know that.
Because a lot of people come in saying, I can't remember my words. So they don't have traditional aphasia. Aphasia is where you can't speak, but they can't find their words and they get really frustrated by it. So that's something that I run into in my histories all the time.
Okay.
Yeah.
So it's important to you.
It's important, I think, that they need to know, because a lot of times they feel like, man, am I losing it? Am I stupid? Or
no, I think really the main thing that you need to know from when we tease each other, okay, but I think the main thing they need to know is it's not them. It's not them. I think the main thing they need to know is that it's your brain, that there's a couple of structures in your brain that start to not work right. And there's reasons that it starts not working right. And if they're not taken care of, bad things can happen in the long run, but they can be taken care of. And this amygdala, or this hippocampus, is kind of a unique deal to me. Okay. I think it's kind of an interesting thing, the way it gets affected, and because everything seems to affect it. I mean, so many things that we do seem to affect it. Like I said, we don't treat for that a lot of times, for most of the time. So let's talk about that. Let's talk about why we see changes in memory in our patients, the things that can cause that hippocampus frontal lobe connection to go wrong.
Okay, so I'll just lay out one thing that's technically important. So as your frontal lobe talks to your hippocampus, there's a lot of communication. This is really interesting because in that communication, brain cells talking to brain cells, if there's inflammation, that communication doesn't really work. We go into a lot more specifics. People have dedicated their lives to figuring out how, because it's actually pretty interesting. How do you actually remember a word? How does our brain take that signal? It's kind of like computer programming. How do you take that signal of a word, distill it down, and create a memory of it? It's phenomenal. But in essence, simplistically, then inflammation doesn't allow frontal lobe to talk to hippocampus to talk to other areas of the brain too well. So inflammation can come from a variety of sources. It could be systemic inflammation. So lots of times elderly people are in the hospital, they get an infection, all of a sudden they develop delirium, where delirium's like they don't know where they are, they don't know anybody, their memory is just completely shot. So that's one classic example of what inflammation will do to the hippocampus. Also, they talk about people going for surgery. They get anesthesia, they come out, there's inflammation with the surgery, and they develop dementia after the surgery. We've seen patients like that in cases like that. Now the literature on Alzheimer's is totally going towards inflammation. It's going towards blood sugar elevation. So you can either be diabetic or pre-diabetic. Both of those situations create a lot of inflammatory cascades in the brain, not allowing your brain to work. Other examples include what's now referred to as Lipid Polysaccharides. We've done a lot of broadcasts on it.
Guts. I was going to say all the inflammation that comes from the gut.
So Lipid Polysaccharide is a piece of a bacteria, a certain type of bacteria that's prevalent in the gut. And so these bacteria we're finding, or pieces of bacteria, can be really high in a number of conditions, especially blood sugar dysregulation, obesity, inflammation. And so these pieces of bacteria can actually go into the brain and inflame the brain, break down the blood-brain barrier, which we talked about last week. So now all this inflammation goes into the brain, and then as a consequence of that, the brain immune cells get activated because they're saying, what the heck, there's inflammation here, we got to take care of it. And so they start killing brain cells because they're trying to get rid of the inflammation. As a consequence of that, brain cells in the memory area are sometimes the first to go, and that's why people have problems with memory during these types of events. Stress hormones. Stress hormones are huge. So stress hormones actually bind to your brain immune cells, can actually activate them and cause them to create havoc in your frontal lobes, where working memory starts, as well as the hippocampus. So there are now new therapies being discussed in literature, like with people who hit their head and have concussions or traumatic brain injuries. They give them basically adrenal blocking medication. So the adrenal glands make adrenaline, they make cortisol. So they give them adrenal blocking medications as one of the first therapies so that their brain inflammation calms down, as well as their gut inflammation. So this is the new frontier within the realm of memory. So you as a patient out there watching this who has short-term memory loss, like we've described, if you're still having it, then there's some aspect of inflammation in your body that has not yet been figured out. We see consistently that patients, their memories do improve, but occasionally there's a patient whose memory does not improve. And when that happens, there's some inflammatory problem being missed in their body. And inflammation can come from a number of different sources. It can come from your gut, as Dr. Rutherford said. It can come from battling infections like Lyme disease, which is now known as an autoimmune problem, rheumatoid arthritis. It goes on and on. Hashimoto's thyroiditis.
Epstein-Barr affecting Hashimoto's.
Exactly. And the infections, your immune system is attacking the infection, which is then causing more attack on your own tissues, and that inflammation goes into the brain, setting off all of this. So consistently, we've seen patients go through, in the properly selected candidates, as we commonly say. We're not saying this is a cure for everybody, but when you do this right and you walk a person through this process who's going to have the capacity to go through this process, we see that by taking care of their inflammation, getting their blood sugar regulation under control, calming down the stress hormones, because we're calming down this fear center in the brain. Watch our previous broadcast on depression and anxiety. We are working to dampen the immune system, as well as decrease absorption of bacterial byproducts from the gastrointestinal tract. With doing all that, then we seem to see that the working memory, the brain fog, dramatically improve, and people are able to think clearer again. And it's something that they're really happy about, because as we've said in previous shows, that you can get your knee replaced, you can get your hip replaced, you can't get your brain replaced. And it's throughout the literature that the longer this goes on for, the more damage and the more probability, if you have a genetic tendency for Alzheimer's, the stronger that probability becomes. So it's best to handle this early on.
Mm-hmm. Yeah, that kind of summarizes it. I mean, that's a lot. I mean, you could go on for pretty much every factor that you alluded to that can affect inflammation in the brain. We have probably an hour online about individually or more. And so Dr. Gates went through all of those in kind of a consecutive fashion, as opposed to explaining them all, because each one would take quite an explanation. Even low blood sugar. Even low blood sugar. Yeah, you get irritable, shaky, and you don't eat, and you get irritable, shaky. What happens? You get irritable, brain, frontal lobe.
Your frontal lobes are going. Exactly.
And then maybe you get a little foggy and that type of stuff, and then you eat, and all of a sudden you clear up, you can think again, and so on and so forth. All of those reactions. Fatigue is you're affecting your brain, and if that's inflammatory, it could be affecting your fatigue. You don't remember very well, because that's also affecting all this. And the inflammation affects across all the different parts of the brain, but we're just specifically talking about that area. Or is the inflammation are you saying more specific just to that hippocampus?
No, it's throughout the brain. It's just that in the hippocampus, I probably should have commented on this. The hippocampus is one of the few areas in the brain where we actually grow new brain cells.
Yeah.
So one is your olfactory nerve, so where you smell things in your olfactory bulb, basically. And then also in the hippocampus. So brain cells are dying, new brain cells are growing. So this is one area when there's a lot of inflammation or there's been trauma or the immune system is pissed off, then this is going to go first because new brain cells don't grow well in those conditions.
When that inflammation is removed, that memory comes back.
Yeah.
It comes back fairly rapidly.
Right.
I mean, it's interesting to me.
We're not saying we're curing Alzheimer's. We're saying when you handle it early in the context of this.
Right. We have a talk on Alzheimer's.
Yeah. You can go ahead and talk about it.
Exactly. So yeah, it comes back. And when I say fairly quickly, we'll usually treat people for like 3 months, 6 months, 9 months, whatever the case seems to call for. And they might be here for fibromyalgia, but you'll see the brain fog lifting relatively early.
Usually it goes pretty quickly
in the process. That's always been a surprise to me, and now I understand a little bit more why. So that's really it. So in the end, the takeaways.
The takeaways are keep your stress levels low. That's easier said than done. But low stress hormones is really productive for good memory. Perfect blood sugar regulation. So not low blood sugar, not high blood sugar, not too much insulin, not enough insulin. So the right amount of blood sugar and insulin is really important. A low inflammation stemming from the gut, number one. So we talked about these pieces of bacteria. It's called subclinical endotoxemia. Go ahead and watch some of our broadcasts on that. Also the immune system. So if you have an autoimmune problem, that immune inflammation, in whatever way, shape, or form, if you can calm it down, that's probably going to be a good thing for your memory. So if you can do all those things, and they do associate regular exercise, vigorous exercise has been really good for the brain too, in terms of the hippocampus. You do all that, that's going to give you the best probability of keeping your memory really sound. Also, good sleep is not a bad thing either.
Yeah, and it's even more complex than that, but that's really a good baseline. That's really a good baseline. So like, and I say it's more complex than that, not to discourage you, but we get a lot of folks here who've been to other alternative practitioners, more alternative because the medical profession doesn't really approach it this way. So we'll see more from alternative practitioners. They've taken an adrenocom, or they've taken, that's a company, huh? They've taken something for their adrenal glands to calm it down, or they increase their cortisol, or they've taken something for blood sugar, or they've changed their diet, and maybe they get clear for a little while and then it comes back. And it's because, one of the biggest reasons, it's because it's multifactorial. Dr. Gates just named about half a dozen things that can affect it. And in reality, most people have a combination of some of those. You know, who's got an immune problem, who's got an immune problem in their gut that's affecting their thyroid, that's affecting their brain. So the baseline that Dr. Gates just put down is really very good. If you follow that and you're still having problems, then you need to go somewhere and find out what those other problems are. And if you've been there and that hasn't worked,
well,
then you need to
watch more of our
videos.
That's what
I guess watch more of our videos. So, but it's going to be somewhere within the framework of what we just got done talking about. We are pretty good at evaluating patients and understanding where they are. I mean, there are people come in here who have Alzheimer's and they're not getting better. They might get a little bit better, but I mean, they're not getting back to normal. And if you understand the nervous system as Dr. Gates does, and you evaluate it, and you can look at the entire case, you can kind of have a pretty good idea what's going on. But if you follow those basic premises, you will be improved. You will see improvement. You'll probably see improvement in a lot of things. And if you have a bad gut, along with all that, you need to find somewhere and figure that out and get it fixed, because that's a big part of it too. And so fire in the belly, fire in the brain, they used to say, or fire in the brain, fire in the belly. I think it's a Chinese thing, ancient Chinese saying, I think so. So that's short-term memory loss, brain fog. You take this and you watch last week also along with this episode, and I think you should have a pretty good idea of what's going on. So anything else?
I think we covered it.
Okay.
Yeah.
So that's it. We will see you next week. Keep your comments coming. We enjoyed them both ways, plus and minus. they kind of really open our eyes as to what's going on out there and what's known and what's not known and what people are feeling. It's really a cool thing for us. It's really very helpful to hear both sides of the story. And we get a lot of ideas on what to do here from those comments. So please feel free to comment. And we're okay. We got thick skin. And then we will see you next week. Okay.
Okay. Thanks for watching.
All right.